I'm going to talk a little bit about cancer before I go to my pet topic, blood cancer. You all probably know we recently had World Cancer Day, celebrated on 4th of February. And the theme this year was closing the gap. When it comes to closing the gap, cancer community is talking about reducing the discrepancy between the care each individual receives. Cancer is the second commonest cause of death in the world. It's a major cause of death, only secondary to cardiovascular disorders. And also, cancer can be prevented. We can prevent about 1/3 of the cancers. And also, cancer has some warning signs. Certain cancers, if you detect early, if you go to the right person early, the mortality can be reduced. When it comes to common cancers, as I mentioned, 1/3 can be prevented, and certain ones, if you go and seek medical care early with warning signs, your outcome can be better. Now, people who have been to London will know, they talk about minding the gap. Or when you go in the London underground, each time the train stops, there is a warning sign saying mind the gap. Which means there is a gap between the platform and the train. So if you are not careful, you can break your leg. You can step onto the gap and get into trouble or can get harmed. Cancer care also have the same impact. If you don't get the right treatment, you can end up in a very bad situation. So what do you know about the gap in cancer care when it comes to this discrepancy? So why some people do better and not everybody? There are certain reasons behind this. When it comes to recognizing this issue, the Cancer Day theme this time is closing the gap. Not only this year, that theme is from 2022 to 2024. So in the year 2022, the theme was to recognize that there is a problem. So we have to recognize there is a problem in the cancer community. For people who take treatment, their outcome is different depending on where they live, how much they can afford to pay, which is very applicable in Sri Lanka. Their educational level, if they know somebody, particularly in the healthcare center or healthcare sector, they will have a better outcome. And also, depending on the lifestyle, ethnicity, the outcome can be different. Now, to explain this further, if somebody in the United States or in the UK, in a developed country, get the same cancer, will have a better outcome or better chance of cure or better chance of getting better compared to low-income countries or middle-income countries.
Or outcome or prognosis of cancer patients depending on where they live. Somebody living in the developed world will have a better outcome compared to someone from low income or middle income country. And also the same applies in the same country. If you take two individuals in a developed country, depending on their financial abilities, their education level, and depending on ethnic origin, the outcome can be different. So the idea of having this Cancer Day from 2020 to 2023 is to recognize that problem and take actions to minimize. In 2022, the idea was to recognize there is a problem like that and there is a discrepancy. And in 2023, that is this year, the aim is to get together and take some action at our community level, at local level to mitigate it. And next year, of course, taking it to the next step, that is at the higher level, make people who govern us change the system. And now, that is very briefly about the Cancer Day and what we are planning to do worldwide to reduce the care gap. And have we done that in Sri Lanka, or have we done that in Lanka Hospital? I'm going to take next few minutes to see how we have developed Lanka Hospital Cancer Center or Lanka Hospital Blood Cancer Center. I started coming to Sri Lanka from 2014, now 8 years, and we initially started treating blood cancer patients in general medical wards for a while, and then management was very kind at the time. They gave us a dedicated ward due to a reason which I will explain later. Blood cancer patients are unique and the staff care for them, and the space they get treated has to be unique as well. So what is hemato-oncology, or what is blood cancer? Hematology or oncology is part of medicine, and the unique thing about hematology in the way it is practiced in the West or developed countries is we get involved in diagnosing and treating at the same time. So what is special about blood cancer? And we diagnose and treat by the same unique individuals, and we use certain specialized techniques to diagnose blood cancers. And when it comes to blood cancer, it is not one disease. All the cancers coming from blood, bone marrow, and lymph nodes are grouped together and called blood cancer. And here I am trying to show you a diagram of cells in the body, or blood cells in the body, and those cells are made in the bone marrow, and everybody knows who are meat eaters what bone marrow is, and we see bone marrow in other animals. When it comes to blood disorders, the history is the crucial one. We need to know, or ask, or patient should know, tell us why they are coming, and there are certain investigations required which all can be done in Lanka Hospital. Then the imaging and management of Lanka Hospital has very kindly arranged necessary imaging and investigation facilities for us to run this unit. And again, this image where we look at certain or different types of blood cells under the microscope, which is a crucial part of diagnosing blood cancers. And the next one, we do a procedure called a bone marrow aspiration. And this is a little bone marrow aspiration needle we use for the procedure. And those are techniques we use to diagnose blood cancers. And when it comes to leukemia or blood cancer, it is a very vast subject. It's not possible for me to explain or tell you all types of blood cancers within few minutes. To simplify or oversimplify, I have put it as acute leukemias, chronic leukemias, and also we classify leukemias depending on the cell of origin. How do people with leukemia present? Some leukemia patients present with symptoms. They come and tell the doctor there is something wrong. So that is what we call they present with symptoms. They can come with fever, they can come with feeling tired or bleeding. Some people come with lumps or bumps we call. Those are that is the group of people who come and tell us there is something wrong. So we do further investigations to diagnose blood cancer. There is another group of patients who get diagnosed incidentally. That is, they do a blood test for a different disorder. For instance, if you do a blood count because you have diabetes or any other complaint, we may diagnose somebody having a blood cancer. Those are called chronic blood cancers, which are unlikely to give symptoms. So that is about leukemias. There is another big group of diseases called lymphomas. That is cancer of the lymph nodes. We have put together hundreds of different types of lymphomas, and we call the collective name lymphoma or lymph node cancer. And the next big group is myeloma. Again, it's not a single disease. There are different types of myelomas, and they are treated differently, and the outcome is different. And this is also called bone marrow cancer. What do we do for cancer? And I told blood cancer is a unique disease, is a unique cancer. Certain blood cancers we don't treat, we only watch and wait. And certain blood cancers are not curable, but it will not kill you, it will not kill the patient. So we don't want to use toxic drugs to satisfy ourselves. Hence, some blood cancers we don't treat, we only watch and see how it goes. And the ones which are more aggressive or more difficult to control, we can use chemotherapeutic drugs, or we can use radiotherapy rarely. We do bone marrow transplants. All these are available in Lanka Hospital. Also now we are moving away from traditional chemotherapy. There are certain new drugs which are called novel treatment options or targeted treatment or specific treatment, which will target only cancer cells and spare normal cells. And this is an oversimplified diagram again about bone marrow transplants, which we do in Lanka Hospital. It is a treatment modality to prevent a blood cancer coming back. It is not a treatment modality to get rid of a blood cancer. Once we get rid of blood cancer, bone marrow transplants are done to prevent it coming back. And bone marrow transplants are done here in Lanka Hospital and all over the world, most of the developed countries as well. There are newer techniques or more refined bone marrow transplant type immunotherapy called CAR T cell therapy, which is getting developed, and we hope to develop that section in Lanka Hospital soon. So somebody getting a cancer, it is very confusing, and particularly if there is no proper system, whether it is to watch and wait or not do anything, whether you go for a trial treatment, whether you have non-intensive chemotherapy, that is without the aim of cure, just to keep it under control, or whether you have intensive chemotherapy. Certain blood cancers are curable, so we give aggressive treatment to cure. And also, stem cell transplant or bone marrow transplant is another type of chemotherapy given to aggressive blood cancers. Now, those are the treatment options, and I always tell what is more important is the skills as a physician. Cancer patients very rarely die from cancer, but they die from other issues, and main killer is infections. So most of the patients with cancer, they die from or die due to infections. And some of them can die due to bleeding or getting blood clots. And also there can be certain changes in the chemistry or chemical changes in the blood which can cause somebody to die. And when we tell, okay, a patient died from leukemia or somebody died from cancer, it is very rare cancer itself causing that death. It is most likely they die due to a secondary cause, either due to the cancer or due to treatment. The most important thing is infection prevention. If you want to make people live or survive from cancer, particularly this implies to blood cancer. In the unit we run in Lanka Hospital has very stringent infectious control procedures. I started wearing a mask and not wearing long sleeves or tie long before COVID infections came. Blood cancer patients are very prone to chest infections. 9 out of 10 deaths due to infection will be due to chest infections. So the practice of preventing infections has been there long before COVID. Hence we need to continue that practice even the threat from COVID is lesser now. Have we done any difference? So I started telling you guys the Cancer Day theme is reducing the gap. There is a gap between survival, a gap between the care they receive, between countries. In developed countries, people live longer when they suffer from cancer, and poor countries or low income or middle income countries have a worse outcome. And also in the same country, depending on their educational level, their financial ability, their contacts, lifestyle, the cancer outcome is different. Have we done anything in Lanka Hospital or in the Lanka Hospital Blood Cancer Center to mitigate this? Long before this Cancer Day theme came as reducing the gap, we started looking at that gap in a developing country like in Sri Lanka. That started 8 years back, and we collected all the data, how many people we treated in Sri Lanka, in Lanka Hospital, and also how many patients got cured, how many are still alive. And we have published this related to a blood cancer called multiple myeloma in a journal by American College of Oncologists, and they gladly accepted our data after a lot of scrutiny to see raw data, and after seeing what we have actually done in Lanka Hospital, they agreed to publish in one of their official journals. And what we have shown here is, with right treatment, with the right setup, with the right training, with the right staff and the right team, it is not only me. You can read the list of names here. A lot of consultants, a lot of nurses, microbiologists, radiologists, oncologists, hematologists. Everybody get together, and even staff from the laboratory who has helped us have contributed to this outcome. We have shown if you do it correct, we can have comparable results to Western countries. These are called survival curves, where we will plot survival and we will compare that with the developed world. And not only for myeloma, we have done the same thing over last 7-8 years. This is for lymphoma. There is a particular type of lymphoma called Hodgkin's lymphoma. We have looked at all the data and patients who got treatment in Lanka Hospital Cancer Center. It is again a teamwork. When you compare this survival or the outcome, as the Cancer Day theme says, we have tried to reduce this gap between developed countries and in a low middle income country like Sri Lanka. When you compare the survival curves, we have shown in Hodgkin's lymphoma, we can have comparable results. Again, this is not a one-man show. You can see the names, different specialties, and also non-medical staff has contributed to this outcome. And this comes to acute leukemia. AML or acute myeloid leukemia is the deadliest leukemia in the blood cancer world. Even in the developed world or high-income countries, 5-year survival is 30 to 40%. We have analyzed the outcome in Lanka Hospital Blood Cancer Center, and this was published in an official journal by British Society of Haematology, where I am a member, and they have accepted this paper and published it to show with the right setting, right staff, right space, and the strategy. And they say there are 3 things: the space, staff, and the strategy. If you use it correctly, we can have comparable outcome for people who has some continued treatment in Lanka Hospital Blood Cancer Center. Then it comes to bone marrow transplants. This was published in the European Bone Marrow Transplant Registry annual sessions. Last year I couldn't physically go there because of COVID, but they accepted this as a presentation. This is comparing our bone marrow transplant data. So doing a bone marrow transplant is not successful merely because the patient is going home from the hospital. Any blood cancer care, when they come to Lanka Hospital, when they leave this door, front door, we don't count this as success. So the success depends on how long they live with the right quality of life. So that is where the success comes. So we can do 200 transplants and we can treat 2,000 patients and we can give something and put them out and take some money. That doesn't mean it is successful. That financial success or the success by counting who came and went is not the right success. So the right success in cancer care depend on their life expectancy or the survival with the right quality of life. So these are the transplants we have done, and we have compared it with the transplants in the Western world. These are low risk transplants, and we have published it, we have shown it, the peer review has accepted. This is very credible data where we have done this safely and successfully, measuring for how long they are going to live. That's the crucial thing. How long somebody is going to live after a transplant, for how long somebody is going to live with the right quality of life after treating a blood cancer, whether it is myeloma, leukemia or lymphoma. And I always worry about infections. That is the main killer in blood cancer, and we have a very strict policy. That is probably the only time people get not very happy with me about the way we manage the space of blood cancer care. And this is how we did the blood cancer care during the COVID pandemic. And we have shown here again, this is peer-reviewed data. Reviews have seen our raw data, even the Excel sheets, and we have shown with the right attitude, the right strategy, we have very successfully continued blood cancer care during the COVID pandemic. And this was also published in a very prestigious international journal. The summary, the take-home message, this is for healthcare workers. Together we have shown the healthcare community can reduce the care gap. And this is the summary, all the take-home message coming from the WHO related to World Cancer Day. And I would like my colleagues here, everybody from top to bottom, to understand and take home this message. And we have practically shown that we can reduce this care gap and we can get the comparable results to the developed world when it comes to blood cancer care if we work together as professionals. And this event was organized few years back. Some of you will remember, patient staff, we celebrated a blood cancer survival day. And that was a very bad word to hear. Once upon a time, if you have leukemia, you will not survive a day. So people will psychologically go down and they will die even before they get treatment. We have shown blood cancer is curable and blood cancer is treatable. I'm very glad that Lanka Hospital also contributed for training of first blood cancer specialists in the state sector. Everybody who are consultants in blood cancer care in Sri Lanka, hematologist has their first training in the Lanka Hospital Blood Cancer Center, merely because there was no other place for them to go for training. And very kindly management at the time agreed to train them, and we didn't charge anything. They were free to come here and enjoy the training, and we are grateful that we got that opportunity. And to finish my talk, thank you very much for giving this opportunity once again to Lanka Hospital management, sales team particularly, and my colleagues. And also I would like to thank all my patients and all Lanka Hospital patients who had the trust despite maybe by marketing by other healthcare institutions. They were brave to come and trust us and get the treatment. And clinicians, staff, hematology unit, particularly the nursing staff who find very difficult to work with me day in, day out, laboratory staff, radiologists, and particularly to LHD head for tolerating my request and helping continuously. Thank you very much.